potential, the Faculty of Health Sciences has established the Life Changers Fund. Partner with us to help our life changers reach their full potential by contributing to the Student Solidarity Fund. Your contribution will help support students who are in need to pay for accommodation, tuition, food, and procure PPE. Join us and help support our students to reach their full potential. Through any contribution, you can be a life changer too. Developing life changers together.
Good afternoon, viewers, and thank you for joining us today on our live stream, which will focus on sharing University of Pretoria's plan for COVID-19 vaccination rollout. My name is Professor Tivani Mashamba-Thompson. I'm a Deputy Dean of Research and Postgraduate Studies at the University of Pretoria's Faculty of Health Sciences. I will be joined by my colleague today, Professor Ameena Goga. Professor Ameena Goga is a pediatrician, and she's an extraordinary professor at the Faculty of Health Sciences at the University of Pretoria. She has a master's degree in mother and child health from ICH London, and epidemiology master's from Columbia University, as well as a PhD from the University of Pretoria, and a certificate in pediatric pulmonology. She's currently working as a chief specialist scientist and a deputy director of the Health Systems Research Unit at the South African Medical Research Council. She's also a PI for Clinical Trials Unit of the HIV Prevention Research Unit at the South African Medical Research Council. She's a consultant in the Department of Pediatrics at Steve Biko Hospital at the University of Pretoria. Her research includes preventing vertical HIV transmission, especially with breast milk HIV transmission, preventing maternal HIV acquisition, and developing model systems to improve maternal and child health at all levels of health systems. She also is specialized in systems and monitoring long-term health outcomes. She's also involved in the University of Pretoria's Health Sciences COVID-19 vaccination rollout. Welcome, Professor Goga, and thank you for joining us today.
Thank you very much, Tivani.
Thank you. We have some questions from our students and viewers, and
Sure.
The first question is with regards to the Johnson & Johnson's vaccine that we are rolling out. Tell us more about the Sisonke clinical trials phase 3B.
Okay, so as you know, there have been several COVID vaccine trials that have been conducted across the globe. We in South Africa have conducted 3 of those trials. We've participated in the Novavax study, we've participated in the Ensemble study, and we've done the AstraZeneca trial. So of those 3 vaccines, the one that seems to be the simplest to implement if we want to go to scale and needs very little storage or very little advanced storage, and the one that seems to have high efficacy against the variant that we're currently finding in South Africa is the J&J vaccine. So the phase 3 trial has already been conducted. South Africa was one of the countries, and it showed promising results. And so now the next step is to move towards licensure of this vaccine. But in the meantime, we have a bit of a hiatus. And so in order for us to get access to vaccine, which could potentially protect our health workers who are a very vulnerable community, we've decided to put in place a phase 3B open label study. So 3B because 3 is over, we're waiting for registration, so 3B. Open label because everybody gets vaccine, you know what's in the vial, there are no placebos, so everyone gets vaccine. So as part of the early phase of the rollout, we're initiating it as a phase 3B open label study, especially for healthcare workers.
Oh, thank you. That's interesting to know. So I would like to know how the Steve Biko Hospital, particularly the Faculty of Health Sciences in UP, how are we going to be involved in this national vaccine rollout?
Okay, so the vaccines will be delivered to South Africa in batches, and batches of 80,000 doses. the first batch of 80,000 doses, and these are all research vaccines that were produced for research purposes. So these vaccines, the first batch arrived in South Africa about a week ago, just over a week ago. And in order to roll out the first batch, we needed to identify 17 health facilities that can partner with research sites to roll out this Sisonke program. Why research sites? Because it's still a phase 3B trial. And the research sites were chosen because they have participated in the J&J study. So we have 4 research sites in the vicinity of Tshwane that have participated in the J&J phase 3 study. And so they've all then now partnered with Steve Biko Hospital. And of course, the University of Pretoria, it works very closely with Steve Biko Hospital. And so by virtue of that relationship, the faculty at the University of Pretoria has become involved in this very exciting venture. And I think, for me, I think it's very gratifying and it's wonderful to be involved in such a venture to bring vaccines to healthcare workers, who many of whom have dual affiliations, affiliated to Steve Biko Hospital with an academic affiliation at the University of Pretoria. And so we've been working very closely with the University of Pretoria and Steve Biko Hospital and academics to try and put in place the right systems to roll out the vaccine to the right people in this phase of the program.
Yeah, thank you. I think we've been very fortunate to be part of this. So let's move on to other hospitals and universities. And how will they also be involved in this?
Okay, so as part of the first 17 hospitals that were identified, there are clinical research sites that are attached to the University of Witwatersrand, the University of KwaZulu-Natal, and the University of Cape Town. And so those sites are then involved in the vaccine rollout, but through the hospital that they're affiliated to or through the research sites that they're affiliated to. And then as we move on with batch 2 of vaccine, which we hope will be arriving fairly soon in the next 2 or 3 days, the vaccine rollout will be expanded to additional hospitals. And we're trying to target hospitals that are not in urban areas, not always privileged. So we're trying to roll out a little bit wider for the second batch. But I must say that from the lessons that we've learned with the rollout in the first batch of hospitals, and especially the lessons that we learned from Steve Biko Hospital and the University of Pretoria, will really help us to roll out the vaccine. Because if you look at where the numbers stand right now, the demand was huge in the Gauteng province. And if you look at Steve Biko Hospital and the University of Pretoria academics, we have really done the most number of vaccinations in the country. And so we have lots of lessons to learn. We've had public-private partnerships helping us to get through this initial week, actually it's a week now, week of rollout. And so the lessons that we've learned at Steve Biko Hospital in association with the University of Pretoria will really stand us in good stead to roll out to other hospital sites and other campuses.
Yeah. Thank you. It must have been a very exhausting week. So I would like to know more about this Sisonke strategy, the rollout strategy. How does it work, the strategy of Sisonke? So
our strategy when we thought about this was to get access to health workers who need access to the vaccine. And so we really are prioritizing category 1 health workers who are patient-facing, so direct face-to-face contact with patients, because we have a limited supply at the moment. So doses are coming in batches of 80,000 over the next 2 months or so to reach about 300 to 500,000 doses. And so with the strategy of Sisonke, our main aim was to say, let us work together. The only way we can roll out such a large number of vaccines to specific populations is if we all work together. Research organizations working with academics and universities working together with hospitals. And so that's where the concept of Sisonke comes from. And so with the rollout, we hope that over the next 3 months, we would start small, target all the category 1 health workers to start with, expand to hospitals that are not really in urban areas, so expand slightly based on the capacity that we have. And then once that's done, we can then start rolling out to category 2, 3, and 4 health workers.
Yeah. Oh, thank you. So yes, when you're talking about categories of healthcare workers, I would like to know about the students that are involved in clinical training platform.
Yes.
Will they be involved in administrating the vaccination as vaccinators, or will they also qualify to receive the vaccine?
Okay, so those are two very important questions. So the first one is, are students going to be vaccinators? At this stage of the early rollout, students are not vaccinators. I do believe that for the national rollout, once there is a vaccine that's accredited and registered in the country, so licensed in the country, then students may participate as vaccinators. But for now, with the Sisonke study, because it's still a phase 3B study, it's health professionals who are qualified, who are vaccinators, so mainly nurses, although doctors are also able to deliver the vaccine. And then are students eligible to vaccinate? Yes, for sure. If you are in the clinical years and patient-facing, so if you look at medical students, particularly years 4, 5, and 6, yes, you are eligible. I think our challenge at the moment is just to make sure that everyone who's eligible gets access to the vaccine. And so we have put in place schedules to make sure that different groups come at different times so that we can manage the number of people who stand and wait for vaccinations, you know, bearing in mind that we have to maintain social distancing. So we just have to adopt a strategy to make sure that we get people in batches and according to a schedule.
Yeah, that's fair. I think you've got to play safe in this pandemic, So now we're going to go to the students that are outside the clinical platform. When will the other students and the public qualify for this vaccination?
So we are working in accordance with the Department of Health rollout. So phase 1 rollout specifically targeted healthcare workers. And within healthcare workers, the Department of Health has categorized health workers as category 1, 2, 3, and 4, where 4 is the lowest risk category. For example, if you're just working in an office as a finance officer, or you don't have much face-to-face contact with patients. So for the phase 1 rollout, the early part of phase 1 is through the Sisonke program, which is the phase 3B clinical trial. As soon as the vaccine becomes licensed in the country, then the clinical trial will fall away and the national rollout will take over. And if at that time we still have not covered category 2, 3, and 4 health workers, then they're all eligible at that stage. If we manage to cover all category 1 workers now through Sisonke, and there are then category 2, 3, and 4 who are still need to be vaccinated, then we will move on to 2, 3, and 4 with Sisonke. Otherwise, they will receive the vaccine through the national rollout program, and thereafter, in accordance with the Department of Health's plans, the rollout will then proceed to phase 2, which is the elderly and people with comorbidities, and thereafter it will proceed to anybody over the age of 18.
That's fair. It's good to know that. So some of us won't even fit into any phase. Yes, I would like to know, when you're rolling it out, whether it's national rollout, what facilities will be made available for this rollout vaccination?
Okay, so for now with the Sisonke study, the early phase 3B open label study, we have to be very specific about the facilities, because each facility has to be linked with a clinical research site, because it is still an investigational product, and every draw of the product, and it's only 0.25 mils that needs to be drawn up, needs to be very accurate and supervised by a research pharmacist. So for now, that rollout is quite limited to specific research sites. But as soon as any product is licensed in South Africa and the rollout expands, it's likely, and I can't really speak for the Department of Health, but it's likely that the rollout will start in larger facilities where people have been trained and you have vaccinators to roll out the vaccine, and then it will spread to other centers as well. I think the good thing now is that through the early access program, the Sisonke program, we've been able to test the electronic vaccine delivery system, which is going to be used for the national rollout. We've ironed out any glitches with that electronic system. We've tested the electronic platform that vaccinators need to use to capture the data. And so I think when it's time for full scale up, once a vaccine is licensed, I think that all provinces would be very uniquely and correctly poised to do that rollout efficiently.
It's very good to know that all the systems are being optimized so that when the full rollout comes through, everything is in order. So I would like to know whether people with comorbidities are being considered at this current stage for vaccination.
Yes. Only if you are a healthcare worker. So only if you are a healthcare worker, because the current phase is only for health workers. And the current phase is for health workers, and we're prioritizing as a start those health workers who are exposed to patients with COVID. So those who are category 1 health workers. So if you are a health worker and you have comorbidities, yes, for sure, as long as you fit into category 1. The general public who are not health workers are not eligible at this stage.
Okay. Oh, no, it's, anyway, we know that a lot of people are getting registered on a system. And for those who are getting registered on either sides, will they be notified about the second round of the vaccination for the people who are registering now?
You mean about the second round when we expand beyond category 1?
Yes.
Yes. So what we're trying to put in place now is an automatic scheduling system, so that if you did not get notified now that you are eligible, then it stays in the background of the electronic system, so that when we expand further and after all category 1s have been vaccinated, you will then receive a voucher to say, well, now it's your turn and here's your appointment and your day and time. So we're trying to automate that now.
Oh, okay, that's good. We like automated systems. So, Professor Goga, please tell us, what does this vaccine mean to healthcare workers in our faculty and also healthcare workers in the country?
So I think it brings hope. I think for the whole of last year, since March, many health workers have had to go to work daily to face risks that they had never anticipated, and to be exposed to patients who you know have COVID or who you don't know, because there have been asymptomatic infections. And so for me, this brings a lot of hope and it brings a lot of relief. And I think it just, the point drove home over the weekend when there was such a demand for vaccine at Steve Biko Hospital. And we had queues of about 1,000. We vaccinated over 1,000 people. And some people waited for 5 hours just to receive a vaccination. So I think it really brings hope, because this J&J vaccine has shown that it does protect against moderate to severe disease to a number of 57%. It offers an 85% protection against severe disease and 100% protection against death. So I think to healthcare workers, it just brings a level of hope. It doesn't mean that you should go out and not do any of the non-pharmaceutical interventions. You still have to use your mask. When you're vaccinated, you're not protected immediately. And we still don't know whether the vaccine protects you from transmitting to somebody else. That question remains to be answered. So obviously it might protect you from severe illness, but we want to protect everybody. So you still have to use your non-pharmaceutical interventions.
Oh, that's good. I think the 100% protection against death is very reassuring, and nice to hear that. So from your experience now, you've been rolling out the vaccine, I think maybe for the past week, and maybe you were involved in a clinical trial in the past. Are there any side effects associated with this particular vaccine, and how can these be avoided or alleviated?
Yeah, there are side effects. So like with all vaccines, there are side effects. But what I can say is, for this vaccine, J&J built this vaccine on a human adenovirus 26 platform. So it's an AD26 platform. It's not a new platform. The platform has been used to develop vaccines for a long time, vaccines against RSV, Ebola, and HIV. So it's a known platform, and it's been tested in over 200,000 people. So we have data about the platform. The side effects that most people experience are similar to flu-like side effects. So headache, body ache, flu-like symptoms, a bit of joint ache. Some people experience chills and rigors. If you are concerned, then I would advise taking prophylactic Panado when you've had the vaccine. But apart from that, I think it really is a safe vaccine. There's been no anaphylaxis in all the trials that have been conducted with this Ad26 platform vaccine. There have been no anaphylactic reactions, and so it really is the reactogenicity effects that people experience. If you've previously had COVID, your side effects might be slightly more intense than somebody who has not had COVID. So just take precautions, and if you have a fever post-vaccination, take some Panado. Don't exercise until you feel well. Usually side effects last for about 2 days. Some people don't have side effects and some have more severe. So each person does respond individually, and some people have reported vomiting, but these are in the minority. The vast majority are just general flu-like symptoms, but mild flu-like symptoms.
Okay. I know you've already told us that we are the lucky ones, that we are very close to one of the sites. But I would like to know, will other sites, be able to introduce a vaccine trial, in South Africa? Are there any other sites that will be able to?
Yes, definitely. So for the next round, so when batch 2 arrives, we will be expanding in all provinces, so in all 9 provinces. So the ensemble study or the program will be expanding to at least 2 to 3 more hospitals in other provinces. Our limitation at the moment is that each hospital has to be supported by a research site. And we only have 31 research sites that conducted the J&J ensemble study. So you're kind of limited by the availability of research site staff. What we're in the process of doing at the moment is to capacitate hospital staff to work with research staff so that they can also participate and administer the vaccine. So, GCP training and protocol training for these staff, and to make sure that they are on the delegation logs so that they can also assist with vaccine rollout. So we can spread over many more hospitals. So we're hoping that in the second batch, we increase the number of hospitals from 17 to approximately 30, thereabouts, so almost double the coverage.
That's good.
Yeah.
So yes, you've talked about limitations, and one of the limitations that we've been hearing about with regards to vaccine rollout is this cold chain limitation. So will the other sites that you're mentioning be able to manage the required cold chain for this vaccine, the ones that you think may be involved as well?
Yes, it's a requirement that they have to. And so the vaccine needs to be stored at a temperature of -20, and then it can last for a long time, a few months. But on a day-to-day basis, if you are storing it, obviously you need to thaw it for daily use. And so in that case, it needs to be stored in a refrigerator, which is a normal refrigerator at 2 to 8 degrees Celsius. And in a refrigerator, if you have not punctured the vial, it can last for about a month, so 28 days, thereabout. And so in all the sites that are being selected for this initial early rollout phase, all of them must maintain the cold chain. It's a requirement. And they've all been selected on that basis as well.
Okay, we hope they'll be able to maintain that.
Yeah.
And yes, for our protection.
Yeah.
So you back to the patients now. So after we have received, those who will be lucky enough to receive the vaccine, after you've received the vaccine, is it okay for us, because a lot of people have been, taking vitamins and all the daily supplements. Is it okay to go back to taking such supplements after taking the vaccine?
Yes, absolutely, yes. I think the supplements are for your daily health, and there are no contraindications to continuing to take those supplements. So yes, absolutely.
Yeah. So again, the people who are potential people to take a vaccine, we just would like to know, people who generally have allergies, can they just go for this vaccine as well? I mean, people who normally have hay fever or the general allergies, can they take a vaccine?
So it depends. In most instances, yes, because with normal allergies, hay fever, you're allergic to grass or you're allergic to hair, whether it's cat hair. And so in those instances, usually yes, but we do need to ask a few questions. And the questions are, have you had a severe reaction to anything? Have you had an anaphylaxis? And are you allergic to any of the vaccine products? The vaccine products are quite general. They're usually saline and chemicals to preserve the vaccine. So if you've not had a severe allergic reaction to any of the products in the vaccine or to any previous vaccination, then even though you have allergies, it's likely that you can take the vaccine. You may need a bit of an antihistamine afterwards, but we always have a medical team on standby just to ask these questions and to make sure. If you have had some kind of an anaphylactic reaction previously to a vaccine, then we would suggest, hold on, don't take this vaccine. Let us find out a bit more before we just vaccinate you. But just being at the clinics for the last week and interviewing people or learning to hear people's allergies, most people have been able to be vaccinated.
Okay.
Yeah.
Okay. Yeah. So you must be noticing now in your register that it's getting crowded. More and more people are registering. So now, if one has already registered and changed their mind, can they actually change their mind and
Yes.
not go for the vaccine?
Yes, absolutely. It's not compulsory. So if you have a voucher, so when you register, you get a voucher. If you have a voucher, it's up to you to redeem the voucher.
Okay.
Right? So you can choose whether you want to go to present yourself to the vaccination facility to redeem your voucher. And what we will have in the background through the data system, we will have a count of those people who applied for vouchers, received a voucher, but they never redeemed it. And so I guess that would be the withdrawal rate. So yes, absolutely. You are not forced to redeem your voucher.
Okay, that's good. So yeah, obviously, more and more people are hungry for information on this topic. Are there any available websites or, material available on Sisonke trial and the vaccination rollout?
Yes, so we have created a website. The website is attached to the SAMRC website. So if you go onto the MRC website, and I'm sorry, but I don't remember the website name off by heart, but if you do go onto the SAMRC website, which is www.samrc.ac.za, you will find a link on the MRC website to the Sisonke program, where you'll get a lot more information about who's eligible, what the trial is about, why is it a phase 3B open label study, and then a bit more information about the inclusion and exclusion criteria.
Okay, it's good to know that there's more information.
Yeah.
Okay, yeah. Can one have a normal influenza vaccine after receiving the J&J vaccine?
Yes, one can, because remember, these are two different vaccines. So the one is to protect you against influenza and the other one is to protect you from COVID. I would suggest, though, that you wait. And the waiting time, I would say, should be around 28 days. So I would suggest that people wait. Don't have them on the same day or 2 days apart.
Yeah.
So just be careful.
So there's obviously, that COVID-19 is still around us, and there'll still be a lot of people testing positive. So can one still get a vaccine while they're still actively positive for COVID-19?
Not when you're actively positive and not when you're symptomatic. So we are suggesting that you wait for 4 weeks since your positive test, and that you're not symptomatic when you are vaccinated against COVID-19. So just bear that in mind. So if you're symptomatic, don't redeem your voucher. Wait until you are asymptomatic, and wait for a month after your COVID-19 diagnosis.
Yeah. So how do people make an appointment after getting the voucher? Do they just show up, or is there a system?
Yeah, that's a very good question, because that's what we've been struggling with since last week. So the best thing to do when you have a voucher is to, if you're a student, is to get in touch with either your class representative or with the occupational health services of the hospital in which you're based, to find out if you can get onto one of their lists. We really prefer scheduling, because if people are not scheduled, what happens is we have a whole queue of people lining up for vaccines. Yesterday and the day before, we had 2 floors of people lining up for vaccination. And that makes it difficult because people have to wait for a long time, and social distancing also becomes difficult. So if you are keen to be vaccinated and you are patient-facing, so you are in category 1, I would suggest make contact with either your head of department or with your class rep or with the occupational health services, and make sure that they get you a slot, a designated slot, because anyone with scheduled appointments are usually given a bit of priority compared to those who have just, rocked up unscheduled.
So thank you, viewers, for all your questions. We'll respond to your questions at the end of the chat session. Thank you, Professor Goga, for empowering us with this information pertaining the COVID-19 vaccination. And thank you to the Faculty of Health Sciences at University of Pretoria for affording us this platform to empower each other with factual information. Subscribe to our YouTube channel to discover relevant information. Follow us on Facebook to stay updated with facts and developments. Follow us on LinkedIn to get access to our latest research, and follow us on Instagram to stay current. Stay safe, and remember, your health is in your hands.